Hi, my name is Sophie Brown, and today I'll be presenting on period poverty as a barrier to girls' education. So again, my name is Sophie Brown. I'm from Amherst, New Hampshire. I'm a rising senior at the Dairyfield School with aspirations of practicing regenerative medicine. To further my knowledge in the healthcare field, I founded the medical club at my school with the purpose of educating high school students interested in medicine. I recently attended the Health Career Institute at Dartmouth, where I was able to experience different hospital settings and completed a culminating research project on the topic of the future of medicine, ghost hearts. In addition, this summer, I'm thrilled to have an internship with Advanced Regenerative Manufacturing Institute, for short, ARMY. Well, I will learn how to make the scalpable manufacturing of cells, tissues, and organs. Outside the healthcare field, I have a passion for teaching that I found through volunteering at nonprofit organizations like Breakthrough Manchester, One Prosper International, Advantage Kids Tennis, and helping Afghan refugees settle into their communities. I hope to pursue a career in medicine as an engineer or a dermatologist and be involved in global health to continue advocating and fighting for women's reproductive rights and menstrual hygiene management. So in today's presentation, I will cover the topics of girls' education, period poverty in school, and interventions. What can we do? So according to our world data, 49.6% of the population is female, meaning that there are almost 4 billion women in the world. With this data, do you believe that all of these girls are guaranteed their human right to education? You would be utterly wrong if you said yes. In fact, quote, women make up 2/3 of the world's 796 million illiterate people, end quote. They're stripped of their fundamental education largely due to high costs of secondary schools preventing many marginalized girls from receiving an education, along with child labor, early marriages, conflict, and gender biases. So you may be thinking, I'm not a girl, why should I care about this? Well, investing in girls' education would immensely benefit society. From an economic standpoint, girls' education strengthens the economy as more educated women in the workforce would potentially add up to 12 trillion US dollars in economic growth, according to the Malala Fund. Also, keeping girls in secondary schools correlates directly to fewer teenage pregnancies, meaning that they are breaking the cycle of poverty that would have affected children born into these circumstances. When girls are educated, they lead a healthier lifestyle with higher wages. The World Bank discovered that, quote, just 1 year of secondary school for a young girl can equate to a wage increase of 25% later in life, end quote. The increased wages means that they have the ability to break the cycle of poverty for themselves and for generations to come. The gender inequality that is so deep-rooted in our lives needs to be changed so girls' education is not a privilege, but a right. So when a girl does attend school, she faces another barrier, menstruation. Periods are a universal female experience. According to an international organization, WaterAid, which aims to educate girls on hygiene, states, quote, at any given time, 800 million women and youth worldwide are menstruating, end quote. The average woman will menstruate for about 40 years of their life. When a girl's period arrives, the first thing she looks for is feminine products in order to go about her day. For girls experiencing period poverty, the lack of access to period products has a detrimental effect on their learning. So the consequences of period poverty in school. The inaccessibility to affordable feminine products give girls no other choice but to use unhygienic materials. Products like rags, paper towels, reused tampons, pads leaves girls vulnerable to infections like urinary tract infections and bacterial vaginosis. This is especially prevalent in countries where genital mutilation occurs. A company dedicated to create social change, FSG, studied menstrual health in Kenya. They reported that, quote, 65% of women and girls in Kenya are unable to afford sanitary pads. The inability to obtain products causes girls to fear going to school during menstruation as they worry about the humiliation of bleeding in front of their peers and teachers. Another problem that girls who are menstruating face at school is inadequate facilities for menstrual health management. In order to manage menstruation, girls need access to washing stations with clean water, sanitation, and hygiene. This can also be defined with the acronym WASH, that stands for Water, Sanitation, and Hygiene. The World Health Organization found in a 2019 study that, quote, 43% of schools globally lack sufficient hand washing facilities and soap, a number which rose to 70% when considering least developed countries, end quote. As a result of this, girls feel the need to miss schools on the days that they're menstruating because they don't have access to running water and soap to clean themselves properly and dispose of their period products. It is crucial that girls in schools have sanitation facilities to menstruate without discomfort, so they can menstruate hygienically with dignity. To fully understand the correlation between menstrual health and school absentee among developing countries, there was a 2018 study conducted in Uganda by George Muro. The study was conducted to understand menstruation, the influence of menstruation on secondary school attendance, and methods to estimate school attendance. The qualitative study analyzed girls ranging from ages 14 to 17 in 4 secondary schools in Entebbe subdistrict, Uganda. To get an expansive set of data, 4 different types of schools were chosen: 1 public universal secondary education, 1 public secondary school, and 2 private schools, of which 1 was considered high socioeconomic status and the other was considered low economic status. The quantitative results from the study showed that about 67.8% disagreed with the statement, quote, "period days are like any other days," end quote. Only 4 girls, which is 1%, reported of having proper menstrual hygiene management in their schools, with 14% of the girls reporting that they didn't clean water and soap. The main reasons for girls missing school during menstruation was 92.5% presented with back and stomach pain. 38.5% had a fear of leaking blood. And in addition, also 38.5% had a lack for privacy for changing. During interviews with girls from all 4 schools, it became evident that menstruation was a key factor in missing school. A participant from a low socioeconomic public school stated, quote, "Sometimes when mother has no money to buy materials, aka sanitary pads, I don't bother coming to school." Another girl from a high socioeconomic public school said, "Yes, someone can peep at you. When boys are revising, reading books from that side, you actually don't feel safe. Boys can even see you from their toilets." For menstrual health management, schools must have free menstrual supplies available in facilities, along with a female-friendly toilet to make sure that girls can menstruate safely and hygienically. Within school curriculums during primary and secondary school, everyone should be educated on period and the changes that the body goes through to normalize periods in order to end the stigma. Likewise, teachers should be trained on how to create a supportive environment for girls by allowing bathroom breaks during class and so much more. Okay, so in conclusion, in no world should a basic bodily function hinder a girl's right to education. Globally, schools must prioritize the well-being of all of their students, which includes implementing proper facilities and education for menstrual hygiene health management. When girls can manage their menstruation with access to sanitation and hygiene facilities, affordable and accessible menstrual supplies, education on their periods, and a support environment, then the world will see increased access to education. So here are my references for my slide content. And I would like to thank the Global Health Leaders Conference at Johns Hopkins for giving me this amazing opportunity that is so important to me. I'd also like to thank Tasha Towers for helping me on this presentation, giving me endless encouragement. I really appreciate it. And of course, my wonderful family. So thank you for listening to my presentation. I hope you learned something about how period poverty is a barrier to girls' education. And if you have additional questions, here's my contact information. So thank you.